it's interesting in that in that epidemic there were 11,000 cases. And
that was the estimate, yes,
and epidemics have occurred in the Amazon since then.
Since then?
And this past year, the Walter Reed and Evandro Chagas teams that are working in the Amazon apparently have pinned the vector down to culicoides.
Really?
Yeah.
Oh, isn't that interesting? Because that was one...
That was the one puzzle that you didn't solve.
Yes, that we didn't solve. Yeah. And they found Oropouche in other areas. The Oropouche was on that Braganza area.
Right.
It was in Belém, then down Castanhal, and I don't know where all. Have they found it in other places in Brazil, but too? In the Amazon?
Yes,
I mean,
they have,
up the Amazon.
in a number of other areas since.
Away from that area. Well, isn't that interesting? But that's interesting because culicoides isn't involved in many known.
I think that's the first for human disease. Now, wasn't Francisco Pinheiro involved in your study?
Yes, he was a student who came to the laboratory. I can't remember the year, but he was very much interested in studying virus. His family wanted him to participate too, and then he had an uncle who was interested, and then a nephew, I think, who's now
Otavio Oliva.
He's now with you.
He's now studying with us.
But Francisco went up to your laboratory, and it was just before then or after, I don't remember. He married this girl from Sao Paulo who was a technician who was really an excellent technical person. And they made a nice team for a while. But then that broke up, and she went back to Sao Paulo. And he stayed on. And I think he's now become director of the Evandro Chagas.
He's director of the virus program.
Of the virus program in the Evandro Chagas. Right. Because that program enlarged a great deal into other fields, too. I mean, not that program, but other programs became associated. And that became a center. After we left...
Yes, I think you started something which has grown.
Well, while we were there, they were beginning to get the London groups and the groups from other laboratories.
Now, I remember it was a very sad day when you and Otis left Belém. Tell us what you did.
When we left?
Well, that was 1963.
That was 1963. Well, you know, it was a sad occasion for us. We didn't realize. We've always felt tremendously interested in what we were doing, interested in the next thing that we were going to do, but not until we got there did we really sink into it. And never feeling regret at leaving, but really pleasure in beginning the new thing. But I think that we were really more upset than we realized, because the last 3 months we were in Belém, I didn't write a single entry in my personal diary. I think I was just too. There was just too much being broken up.
And where did you go then?
Then we went to Africa. We went to...
And how did that come about? Was that part of an organized Rockefeller Foundation?
Yes, Rockefeller had decided some time previously to establish a laboratory in Africa south of the Sahara. And they had evidently decided that Otis would be the one who would begin this laboratory. They sent him and me over to pick out the place, in a way. At least it was to be chosen from Nigeria, Ghana, or Liberia. We had a month in each place to survey, get sera from the people in the various localities. And to indicate which place would be most productive and most profitable for working. Well, we chose Nigeria. Liberia seemed unsettled for the future. There was no assurance of how things might turn out if the dictator was deposed or dead. Ghana was too infiltrated with the communists in the government and was influencing the scientific work. You could or could not do certain things and had to be in certain rules of their political regime. And Nigeria seemed the most possible. We found the people in the outlying districts very receptive, and there was a little bit of start in health and public health work. We didn't know that when we arrived there, soon after we arrived, there was a general strike. Everything closed up, even the hospital. The hospital, the professor of bacteriology said, well, you better close up, because he says, we're washing the linen in the hospital, and you can't get the boys to do anything. Well, our boys didn't stop. Our boys carried on doing the jobs that they had been shown to do. We were establishing the mouse colony then, and we had no trouble at all. But we didn't force anything. We didn't make them work, but they realized that this was something they had to do, and they did it. It was wonderful. Then after that, we had the war, and some of our staff had to leave.
In spite of all this, you continued to isolate viruses.
We had our colony going. We had to start from scratch with our mice. We didn't either, because we got some from Lagos. We got our basic animals from Lagos, but we had to build up a colony that was productive of the babies that we had to have for the virus work. So we had to start slowly. We started with sentinels, and sentinels didn't act the way they did in Brazil, partly because I think it was influenced by the agriculture. See, they grew cocoa and other crops where they were spraying. I think that we were never in a really natural condition as we had been in Brazil. We were too close always to habitation and agriculture.
So what did you do to find viruses?
Well, we went to the hospital. For human viruses, we had access to the clinics, and the Ibadan hospital was really organized well and had very large clinics of children and adults. We went to the children's clinic, and with capillary tubes collected blood from those that we picked out with fever and symptoms that were commensurate with possible virus infections. And we got viruses from them. We had an epidemic of chikungunya after a while. We had various periods of Bomba and other rather unknown viruses that weren't producing much illness, but they were a part of the illness of the area. And then we were studying the livestock. The livestock that the beef, the cattle, were pastured in the north, grew up in the north, and were driven down to the markets in Ibadan and Lagos and other areas in that region. They had to come through a country where the disease of cattle up there that trypanosomiasis, so that many of them died.
Yeah.
But the ones that did come down, we took the ticks from them, because there we had a bacteria that we could study, and we began isolating viruses, which we later showed were present in other animals and even in man. They were not viruses that caused.
Now I understand you isolated the Congo-Crimean hemorrhagic fever virus.
We did from the cattle ticks, but we didn't have cases in the human population, and I don't know why. But
and I guess one of your major discoveries was the finding of a virus related to rabies. The
Well, that was most interesting because we had a lot of Simbu virus in the sentinels, from the sentinels in the cattle, and Culicoides was abundant there, and we thought that maybe Culicoides would be a virus that maybe would be involved, but we didn't prove that it was. I don't know, we didn't get anywhere with that. But during that time, we were isolated from a shrew in this area, a virus which you showed was related to rabies.
And you had human infection with that.
Later, we had 2 children who died from it. One died, and the other one got well. I believe that was it. That was interesting. And another virus that was related to Morcula,
the Kotonkan
the
virus.
Kotonkan,
Yes.
which wasn't common either. But
what is your feeling about working during a career with the Rockefeller Foundation? Actually, you didn't work with the Rockefeller Foundation because you were a volunteer.
Well, I was a volunteer.
Otis did.
Otis was. It was really a very rewarding because he was given freedom to pursue the leads that came up, and that's
even if it
worthwhile.
was on $8,000.
that 8,000 went pretty fast, but it was and it was really backed up with some very good support.
Well, I've been simply amazed at the productivity of the team, you and Otis. I went back and looked up some figures. In your first 4 years in Nigeria, 1 out of every 22 samples that you tested, you isolated a virus from.
That doesn't seem possible. I didn't remember that.
You're responsible for, I think, more than anyone else in the world, for the large number of arthropod-borne viruses that are known today, and some viruses that are not arthropod-borne that you found totally by accident. But I think this is an illustration of what hard work and teamwork, taking some chances, not being afraid, and being willing to live your life away from the amenities that we have in the United States has produced. And we're all just very, very proud of you.
Well, it was a very exciting and interesting life.